Welcome to your first lecture in Dental Anatomy and Occlusion. I'm Dr. Chung, and I will be co-directing this course with Dr. Nelson. We're looking forward to introducing ourselves and meeting you in person for the lab component of this DEN 7125 course. And we hope that having these lecture recordings will be informative and helpful to you as a remote learning resource. For part one of this introduction to the oral cavity lecture, I will begin with a discussion of how to view and describe a patient's left or right side from a dental perspective. We will also have an overview of classifying the different tooth groups before going into the teeth numbering systems. And then lastly, I will briefly describe the general anatomy of a tooth. Please understand that while the lecture highlights important points from the textbook, you are still expected to read the textbook and will be tested on the contents therein. Here we are going to be looking at the skull. In dentistry, your main areas of focus on the skull will be the maxilla, which is highlighted in black on the left, and the mandible, which is highlighted in black on the right. When we are talking about the right and left sides in dentistry, however, which side are we actually referring to? Our own as the dental operator or the patient's? So in dental terminology, you will always be referring to the patient's left or the patient's right. We may be coming from all different kinds of backgrounds here, but if any of you are familiar with any theatrical terms, you can also think of it as stage left or stage right, which is from the actor's perspective. So same with dentistry, we're going to be thinking from the patient's perspective and the patient's left and right side. In this picture, we are looking at the sagittal plane views, which means it's from the side. So which side of the skull are we looking at? The right or the left? Putting ourselves as a patient or as a skull, this would be the right side that is being depicted in both portraits. On the right picture, the mandible is highlighted and it's in one piece. It has a left and right side, which is fused in the middle, called the mandibular symphysis. On the left portrait, we have the maxilla. Maxilla is plural because there are two separate bones that make it up. Now, is it the maxilla or the mandible that moves when you are chewing? The maxilla is fixed as a part of the skull, and the mandible is what is moving. Here we have a dental arch. An arch will either belong to the maxilla or the mandible, and each arch has two quadrants. So there are 4 quadrants total in the oral cavity. So if I take a line now and draw it here between the maxillary teeth, we will have a right quadrant and a left quadrant. So one quadrant will have 8 teeth in each. Now here's a question. Looking at our patient, which is in this photo, if I make an X here, which side am I actually referring to for this patient? What would we call it, left or right? So on this picture, if this was our patient, this would be the patient's right quadrant. And conversely, on the other side, this would be the patient's left quadrant. Now another question to identify this dental arch is it a maxillary or a mandibular dental arch? And then how can we tell? So on a maxillary dental arch, we may notice things like the rugae here, or the palate, instead of a tongue or tongue space. And as you learn more about the teeth shapes, you'll also be able to notice that the central incisors are a little bit bigger, and the anatomy of the posterior teeth also belong to a maxillary arch. So these are the kinds of images and orientations that a dental student will need to start learning and understanding, as the rest of your dental education will be based on these dental perspectives and language. There's going to be a lot of terminology coming at you here, and it may feel like you're going to be learning a new language. So all of these terms that I will be going over will also be explained in the textbook, but it does take practice and time and experience, and it won't be achieved purely on root memorization. Now here we have the mid-sagittal plane that we will be discussing, and this is an anatomical feature of what separates the left and right sides. We also have a dental structure, which you see with the black line here, and that's called the midline. So again, for our patient, what side is this? That would be the patient's left side, and on the other side, this would be the patient's right, not our dental operator right side. Now what do you notice about this picture and the midline as we draw that line down the center of the teeth? You may notice that the mandibular teeth are not lined up with that midline. So the mid-sagittal plane is a term and a guideline that separates the right and the left side, but the teeth may not necessarily line up or match perfectly to that line. So why do you think that might happen with the lower arch not lining up with the upper arch? What are some possibilities for why that might be? Well, maybe for this patient, a tooth shifted, maybe they lost a tooth, or a tooth never came in. Maybe they had some crowding, or maybe they didn't wear their retainers. They could have also broken their jaw, and that threw off that lower midline there. So there's a lot of different possibilities, and as you go through and listen to these lectures and participate in class, there's going to be some details or things that we might point out that might not be in the textbook. So it's important to participate and gain knowledge where you can. The faculty here have a lot of experience and knowledge, and we're all looking forward to sharing that with you. So please utilize all of the help that we have to give you here as you progress through this class and in your assignments, as well as through the rest of your dental school career. Now I'm going to show you how to separate the arches between anterior and posterior teeth. The separation is going to occur at the cuspids, also referred to as the canine. The posterior teeth begin posterior to the canines, and the anterior teeth will go from canine to canine, or cuspid to cuspid. So these are your anterior teeth in this picture, and you can also see your canine here on the lower, and here's your anterior teeth for the lower mandibular arch. The anterior teeth will be incisors and canines. As I just mentioned, everything behind the cuspid will be posterior teeth. Which side again are we looking at here? This is the right side. And is this the maxillary or the mandibular arch? So you can think about these questions as you're going through and looking at teeth. It's harder to tell here because we don't see the rugae or the palate, so you would have to know the shapes of the teeth to know that this is the maxillary arch. So for posterior teeth, we have premolars, first and second, and then the molars. So third molars are also considered posterior teeth. You may also hear dentists refer to the term bicuspids when talking about premolars. The correct term is premolars because not all bicuspids have two cusps, as you will learn. Some of the lower premolars actually have three cusps, so it's not accurate to call them all bicuspids all the time. Just recognize that when someone does say premolar or bicuspid, they both are the same thing. But again, the correct term is premolar, and your board exams will also be calling them premolars. For this next example, what is the arch that we're looking at? Is this a upper maxillary or lower mandibular arch? This one is a mandibular arch. As we look at what side we're on again, This side is going to be the patient's left side. If we rotated this picture all the way around so that the lower incisors point downwards, this would still be the patient's left side moving over onto this side. So you always want to look at it from the patient's perspective. Now, is this an accurate model of what the patient mouth looks like? It is for the teeth, but what's missing? So on this model, we won't be seeing anything about the patient's actual tongue. So that's just the tongue space. The tongue on all of these mandibular models or casts will always be blocked out, and that will also help cue you in as to whether we're looking at the maxillary or mandibular part of the mouth. Now we also want to point out here the different teeth. So here in the middle are the two central incisors. Next to those are the lateral incisors, and then the canines or the cuspids that we mentioned earlier. Behind the cuspid are the posterior teeth. We have the first premolar, the second premolar, and then we move on to the three molars, the first, second, and third molar. I use the term permanent molars or permanent teeth because we want to distinguish between the two different dentitions. There's primary dentition and permanent dentition. For dental anatomy class and for the board exams, if something isn't classified or specified as a primary tooth, then always just assume that we're referring to a permanent tooth. If there's a notation, then we would need to specify that it's a primary first molar or something to that effect. If I just say first mandibular molar, then assume that I'm talking about a permanent tooth or an adult tooth. Let's zoom in and look a little bit closer now at the teeth from a proximal view. What does that mean, proximal view? When two teeth are lined up together side by side, the space in between is called the interproximal space. Looking at it in between from the side here is what we call a proximal view. Incisors and canines, like the one you see on the left of this diagram, generally have a triangular form overall. Premolars will look like they have two triangles put together, and molars maybe 2 or 3 or even 4. Triangles in the posterior teeth, where you see the points, are called cusps. So that would be this area. In anterior teeth, where you see the point, we refer to those as incisal edges. So these are the basic general tooth forms that you see here. Anterior teeth are generally single-rooted, and premolars can be single or double. Molars can be double or even triple, and they also have variations. As you look in your textbook, there will be examples of all these different variations, and we want you to know they exist. But in teaching dental anatomy, we are typically going to convey to you what we consider the ideal tooth form, what that looks like. And then occasionally too, we will also point out some important exceptions. So once again, we are looking at the functional tooth form from the proximal side view, and it is triangular in nature. Now, if we look at it in terms of geometric shapes, the anterior teeth tends to stay as a triangle, but what about the premolar's general outline form? You might be able to see that it starts to look like a trapezoid. What about the molar? You could also consider that trapezoidal as well. On the other hand, if we go to the mandibular teeth and consider those, the forms might be rhomboidal or like a parallelogram. So there's a lot more content to this concept, and we want you to be able to go into the book and make sure you read and look at these different forms in there and how they describe them. We are going to now shift our focus into how to number the teeth. Keep in mind that there will be more tooth numbering systems than what I will be presenting here, but please be at least familiar with the ones that the book will present to you and how to number them accordingly. Here we have the permanent tooth dental formula. In half a segment, we have 2 incisors, a central and a lateral, 1 canine, 2 premolars, 3 molars, and this makes up 8 teeth for each segment. What else do we call 8 teeth on half an arch? This is what we were referring to earlier as a quadrant. So 2 quadrants of this 8 make up the 16 teeth in the whole arch. So if there's 16 teeth per arch and we have 2 arches, that means 32 teeth make up the upper and the lower maxillary and mandibular jaw in permanent dentition. This is the deciduous or primary teeth dental formula. Let's look at half of a segment again. So here we have 2 incisors, the central and the lateral. We have 1 canine and we have 2 molars. If we look at a quadrant, we have 5 teeth, and in each arch we have 2 quadrants, which will make up 10 teeth per arch. Even as a child, you do have 2 arches, a maxilla and a mandible, so that will make 20 primary teeth in all. What do you notice is missing from this primary dentition formula if we're comparing it to the permanent dentition formula? You may have noticed that the primary teeth do not have premolars. The primary molars are what is going to be lost eventually, and then that will allow room for the permanent premolars to come in, which are called successional teeth. The permanent teeth that come in after primary teeth are lost are all referred to as successional teeth, as they succeed the primary tooth. Now, what do we call a permanent tooth that comes in when no primary teeth are lost after that? So that would be the molar, permanent molar here in this case. The lower first molar is the first permanent tooth to erupt in the mouth that you do not lose a baby tooth over it for. And those permanent molars that come in behind the primary molar, behind the permanent premolar successional tooth, is called an accessional tooth. So in summary, premolars are not considered in the deciduous formula. Permanent teeth coming in after primary teeth are called successional teeth, and the permanent molars that are considered accessional teeth because they do not require the loss of a primary tooth to come in, that would be the accessional tooth there. And here we'll have the successional tooth, along with any successional tooth that comes in to replace the incisors or the canines. There was a bit of content on that last slide, so make sure you review it and understand the terms clearly, especially between successional and accessional teeth. From here, we're going to be analyzing and numbering the teeth individually in more detail. There are many different tooth numbering systems. There's tooth numbering systems such as Palmer's, FDI, and the universal system that we'll touch on here. So the universal system is the one that we will be using in this course, and we use it because that's what appears on boards. It's what will be used throughout dental school, and also insurances in the US use the universal numbering system. In the book, there are different explanations for the other systems which you should review, but we will not be discussing them in great detail here in this lecture. The different disciplines, like orthodontics, may use the different systems. But again, because the universal system is the most applicable for us in this course, we're going to be using that one. So looking at this diagram for the universal system, we start from number 1, which is the third molar on the patient's right side. So 1 is the third molar on the right, number 2 is the second molar on the right, 3 is the first, etc. So it goes up the premolars, the canine, the lateral, and the incisor, which is number 8 for the right central incisor. And this is the 8 teeth in one quadrant. Now, if we continue, we simply go up in number. We'll go all the way to the left side to 16, and then we'll go down on the bottom left, and then go back across to the right, the patient's right. And then that will number from 17 to 32. You're going to need to know all the numbers and be able to identify the tooth with the correct number for your tooth ID exam towards the end of the semester. In fact, you'll be able to learn these teeth so well that you will be able to hold a tooth individually in your hand and be able to decipher which side, which arch, and what tooth it is, and then tell us the correct number. So keeping that in mind as your goal, you'll start to try and practice this each time you're looking at the teeth. As far as kind of mnemonics or tricks and ways that can help get you started to memorize these numbers, one way you can do it is to memorize what is the first molar. So the first molar is 3, 14, 19, and 30. So you might just repeat 3, 14, 19, 30, and remember that those are the first molars. Another way, a way that I liked to do it when I was starting out, was to remember the canines. And the canines are numbered 6, 11, 22, 27. So if you repeat 6, 11, 22, 27, that one's a little easier, at least it was for me, because it rhymed better. But if you have these sets, 6, 11, 22, 27, and 3, 14, 19, 30, then you can at least have a starting point that'll get you closer to counting where the other teeth and what those numbers are. There might be some charts that you can see online or that upperclassmen might show you, and really anything goes as far as what you want to use, whatever will help you to learn and remember these numbers. One last point that I like to use to remember is the midline here. And then I just remember 8 and 9 from the right to the left is the central incisors, and 24 and 25 are the central incisors on the bottom. So you can pick one or all of these reference points and see if that will help get you started. While the universal system for permanent teeth used numbers, the primary or baby teeth use letters. So the permanent teeth went from 1 to 32, and here the primary dentition you can see uses letters going from A to T. You still start out the same way from the upper right with A, and then you work your way to the left before wrapping down and around, going back. Some of the mnemonics that I've found helpful over the years, especially starting out, is for the upper A through J, you can think of that as Apple Jacks. And then for the bottom, for K through T, I think of kindergarten or kindergarten for the K and T. It's also helpful just to memorize the letters from the mid-sagittal plane in case you have to count either way. So here, I just straight up remember E through F is the central incisors from right to left, and then O and P are the lower central incisors, the mandibular central incisors from left to right. The next numbering system we're going to be looking at is the FDI. The top one that you see is for permanent dentition, and the lower one is for primary dentition. So with the FDI, we're going to be using a grid of 4 quadrants, and each grid is going to have a predominant number assigned to it. So if you'll notice on the upper right, that's number 1, and then we'll count over to number 2 on the left, drop down and wrap around from 3 and then 4 back on the right. So staying with the permanent here, we're also going to cut again the mid-sagittal plane. And now we're going to number 1 through 8 for each and every quadrant starting from the middle. So this goes 1, 2, 3, all the way over to the right. On the upper left, we'll also start 1, 2, 3 and go all the way to the end. Same with the lower. We all start with 1 in the center and then count up and over throughout the rest of the quadrant. So number 8 from the universal system ends up being 1 for the quadrant and 1 for the number of the tooth. If we look at the bottom here, let's say the lower left quadrant, although the numbers are going to start with 3 for the quadrant, but then we're going to name the second number based on which tooth it is. So the first molar down here would be 3 for the quadrant and 6 for the number that it is from the center. Now if we are going to the primary dentition, they continue the main quadrant numbering system and they just carry it down into the primary dentition. So we went from quadrants 1, 2, 3, and 4, and we're going to continue 5, 6, 7, 8, again from the upper right to the upper left, wrapping down to the lower left, and then finishing with the lower right. Please be aware that while we aren't going to be naming and using the teeth in detail with the FDI, you still need to be aware of how to number and do this because you may get some test questions on the different numbering systems. You may also see diagrams as well. Diagrams in general may also cover things like the tooth anatomy, which we will cover in the next section. And then again, please look into your book so that you can get more details on some of the other numbering systems that may appear. Before we move on, let's practice a little bit with the numbering that we just learned from the universal notation system. Go ahead and take your time with these next 3 slides, and the answer will be in the notes section of your PowerPoint. In this second example, the arrow is pointing to the canine tooth on the mandibular arch. For this last photo example, the arrow is referring to the first molar on the right side of the patient. In this last section of part 1, we will be giving you a brief overview of the tooth anatomy. As you're reading through the book and learning the different parts of the tooth, you should know that the dentin layer is right beneath the enamel layer of the anatomical crown of the tooth. You should also know where the enamel ends and the cementum of the root begins, and that area where they meet is called the CEJ, or the cemento-enamel junction. On the clinical portion of the crown, which is the crown that shows up above the gingiva, you also have where that dentin and enamel meet, which is referred to as the DEJ, the dentino-enamel junction. The live portion of the tooth here is in the center. And this is what we refer to as the pulp cavity. The pulp cavity is divided between a pulp chamber and a root canal. We tend to separate it with the clinical part being the pulp chamber, and then below that into the root as the root canal. We will study this in a lot more detail with the roots and the pulps as we study the individual teeth. Right now we're learning the areas and the names to get more familiar with the language. I know that by the end of this first part, it might already feel overwhelming. This is all just to help provide the framework and basis to begin your learning on this journey of dentistry you're taking, and it'll help us to be able to talk more in depth about the teeth as we progress. In this view, we include a posterior tooth, and on both of them, we're looking at the proximal view, which is, again, from the side view. An anterior tooth, as you'll notice here, is generally single-rooted, as we mentioned earlier. In this diagram, it's also shown within the alveolus, which is the bone socket that houses it all the way around. It also shows the periodontal membrane and the ligaments that hold it in between the bone and the cementum of the tooth. On the posterior tooth on the right, you'll see a function here that we need to memorize about the split root. So whenever this root has a split in here, it is termed as a furcation, and furcation is a name that you'll need to know and will be hearing throughout your dental career. A furcation can be 2 roots or 3 roots. In the case of 2 roots, we would refer to that as a bifurcation, and for 3 roots, we would refer to a trifurcation. So the furcation in general refers to the area where the root splits. Now, if we look here to the CEJ and then to the furcation area, this area here between those 2 points is called a root trunk. So that's the entire tooth here. This would be the root trunk. We can say that a tooth has a short root trunk or a long root trunk. In the case of a short root trunk, it would mean that the area between the furcation and the CEJ is shorter or smaller. And that's a term you should also know, the root trunk. Again, here we have the pulp cavity. So I can show you on the posterior tooth. This pulp cavity is also divided into 2 sections, the pulp chamber and the root canal. The area around the CEJ is usually referred to as the pulp chamber. And here you'll also notice where the pulp chamber has little sharp points, and those are referred to as the pulp horns, and they tend to mimic the anatomy of the cusps. Like the previous slide, anything beneath the CEJ of the pulp cavity is usually referred to as the root canal. That concludes the first part of our lecture for navigating the oral cavity. Congratulations, you made it halfway. So get up, take a break, stretch, and when you feel ready, we'll go ahead and start part 2.